Uganda Protestant Medical Bureau is an organization that was formed by two churches coming together. That is the Anglican Church of Uganda, or rather Church of Uganda, and the Seventh-day Adventist Church, Uganda Union. And their coming together was to form an organization that was initially established to be a channel of support to the health facilities that belong to these churches. Currently, we have a network of health facilities, 294, 18 hospitals, 10 health center 4s, 59 health center 3s, and 207 health center 2s, with 15 health training institutions. So the board of directors of UPMB came up with a strategic plan that we are implementing for 5 years. And now through the strategic plan, we're looking at ways in which UPMB's mandate is fulfilled.
We facilitate the different health centers through capacity building and the like.
We make sure that the boards are trained to know what their responsibilities are, together with management to know what their responsibilities are, so that there is overall division of power or responsibility.
Currently, we are having about 350 health workers that are being supported directly from Uganda Protestant Medical Bureau.
The aim of establishing Uganda Nursing School Bwindi was particularly to respond to the critical shortage of health workers in this rural part of Uganda. We've had good relationships with Uganda Protestant Medical Bureau. They've supported us as far as leadership is concerned. They've supported us with some of the textbooks. They've supported us with, looking at how we are running day-to-day governance, including management and also the governing council of the school. So trainings are always offered for a number of people who are in leadership positions within the school. And this has made the school to be better and better and better. If you look at Bwindi Community Hospital at the moment, 48% of the health workers there are students who have passed through Uganda Nursing School Bwindi.
This specifically addresses the staffing gap or the staffing challenge that is across the network. So for UPMB to come out and advocate for more staff in the network is really a plus to our facilities.
That strategic plan is defined by clear bodies that run it. And these are defined through the Board of Trustees that hold the trust of UPMB, and the Board of Directors that do the policy development, but also through the board committees that implement the work of the board. Now the board committees for UPMB are 4, where we have the Finance Committee, Audit Committee, Technical Committee, or rather the Health Committee, and the Management Committee of the board. So these are the board committees that drive the work that the Secretariat does. Now I head the Secretariat of about 40 staff, and we implement the strategic plan of the organization. So currently our strategic plan defines our activities into 4 strategic objectives, and that is institutional capacity development, support to health service delivery, support to patient safety and quality, and then research, advocacy, and networking.
Currently, the financing of Uganda Protestant Medical Bureau is majorly from donors. And as we are all aware, there is a bit of donor fatigue, and therefore the activities of Uganda Protestant Medical Bureau may not be sustained in the future. In the current plan, we program to raise internal funding so that the programs of UPMB can be sustainably financed. We also work with the communities through insurance schemes and other schemes to raise resources to finance the required health needs of the population.
We respond to epidemics like HIV, but also around TB, malaria, and as communicable diseases, but also in areas of non-communicable diseases that there may be, like diabetes, hypertension, and heart disease.
But also there is a logistics component that we do support. And in this, we have the joint medical stores. The joint medical stores is the store that was set up through a partnership of the Uganda Catholic Medical Bureau and also the Uganda Protestant Medical Bureau to mainly support the supply of medicines and medical supplies to our entire network.
But also under the same area, we look at service delivery in terms of reducing the unmet need, say towards family planning, which as UPMB we look at as a critical component in health timing and spacing of pregnancies, as the other word that we tend to use.
Under Sustainable Development Goals, we really want to have what we are calling universal health coverage. And in this universal health coverage, we want to make sure that health is actually accessible to the communities that we serve, noting that our network, almost 80% of our facilities are actually in the rural parts of the country.
Basically, that's what we are trying to do as a network to meet the needs of our communities, but also support or rather complement the efforts of our government in ensuring that the population of Uganda is healthy and responsive to what is available in the country.